Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB. And we're going to continue today our series on basically anti-aging and natural approaches to the aging syndrome, as I call it. And that's my term, nobody else's term. But that's how I look at it. You know, we have this sort of fingerprint-like conglomeration of the effects of aging that happen to us individually as we get older. But each of us has our own specific combination of these symptoms and signs that we associate with aging. And so last time we talked about nutritional views on aging and how it can improve the aging syndrome, or how we can improve our quality of life, and how we, through nutrition, can offset the effects of aging, thereby essentially stopping or reversing, even potentially, aging itself. So we can be younger, like we can be younger in 5 years than we are right now, even though we're aging 5 years theoretically. So in other words, what I'm saying there is we have the chronological aging that's going on, and we have physiological aging. The physiological age of each individual is based on many combinations of events within our bodies. It's not just one thing. I know very popular nowadays in terms of the conversation about aging is telomeres and telomere testing. And I've done telomere testing in my practice. I do telomere testing in my practice. And I've seen some very interesting results and their reflection on aging. I like one of the examples that really showed me was the mother who is, or was at the time, 57, who had telomeres of a 75-year-old. Okay, so certainly anti-aging work is appropriate to her issues to help her reverse that aging syndrome. And part of the reason of her aging, or for her aging, had to do with the stress put on her as a caregiver. Extreme stress, dealing with somebody who didn't have full faculties, in other words, full brain function. She carried a lot of stress because of that, whereas the person that she was taking care of, who was 31 at the time, had telomeres of a 9-year-old, because the 57-year-old woman was taking all of the stress. The 31-year-old wasn't experiencing the stress because that was on the other one's back, basically. So you see, stress is a huge component of aging, and especially in Western society where stress is a big issue, and even more so potentially in the United States because of our high productivity and strong work ethic that, you know, means that we don't take care of ourselves in the United States. People don't take care of themselves. They're doing the work-a-day world. You know, when you have in a society, kind of as a rule, maybe a couple of weeks of vacation every year where you get to take care of yourself, and what a lot of people do, they work on the house. You know, they work on all the things they haven't been able to keep up with during the year. Some travel, but we need to be dealing with stress on an ongoing basis. We need to have some tools for that. And this is something that I do help people with, is those tools. So, there are specific kinds of therapies or even self-therapy, you could say, that you can do, like yoga. Yoga is a wonderful tool to help deal with stress and to keep working on your body to help improve its function. Bones, joints, muscle, breathing, all of those aspects are improved through yoga. Same is true with Tai Chi, Qigong. In the Chinese population, you'll see parks throughout China with 100 people in the park doing Tai Chi. And a lot of them are very elderly. This is a de-stressing exercise, as is yoga. Yoga is more of an Ayurvedic approach. Yoga comes more from India, and that's a practice strong in India, whereas Tai Chi is a practice strong in China. And then other parts of the world in the Pan-Asic world, in other words, Asia, meaning India, China, Tibet, that whole region, even Indonesia, etc., practices as a population many of these kinds of exercises, helping them to de-stress. And we see a lot of important results with aging, or a lack thereof, really. We see these elderly people who function very, very well, and then we have societies where a big issue is the food. Part of how they have longevity is that they eat whole, organically grown, very naturally grown foods. And unfortunately, in the United States, what are we eating? We're eating foods that are farmed with 3 ingredients, NPK, okay, so nitrogen, phosphorus, and potassium in the soil. That's not nearly enough to grow the plants well, and that's why, at the same time as that conversion was made agriculturally, we integrated into the whole process pesticides. So now we take away the organic nature of the growing, and we add these chemicals that are toxic, not just to the bugs, but to human beings. So when we eat more naturally, we're getting more of the nutrients, and those nutrients are important because a lot of them are antioxidants that fight the oxidation reduction reaction, or the oxidation that occurs metabolically as well as through damage from free radicals that come from internal and external sources. In other words, from the environment as well as our body's metabolism. So getting the right nutrients, as we discussed last week, is very important to fighting the process we know as aging. Okay. So going back to the subject of telomeres, though, I'll pick up from there, because this week my main focus is on treating the cause, the underlying causes of the aging issues that we see. And I've already mentioned some of those. Telomere shortening is one. What are telomeres? I didn't even talk about what telomeres are today. I should review that. So telomeres are essentially tail base material, or base material at the end of chromosomes, or the genetic material that defines us on a cellular level. DNA, in other words. So telomeres are found at the tail, we'll call it, of DNA. And it's the base material that's used to reproduce the cells and regenerate the DNA in each cell. So it's part of how we regenerate our cells. And, you know, part of aging is happening when the telomeres are shortening. And we saw this in some experiments that were done with cloning that have been done, right? It was found that when the cloned cells of more elderly animals were used to produce new animals from the same genetic base, or in other words, reproducing the animals through cloning, that the animals that were produced may actually be chronologically younger, but the DNA was that of the older animal, essentially. So we built in more rapid aging in the cloning process. So that's an interesting result with cloning. And that's kind of the root of how telomeres affect aging. You have this base material, and as cells are reproduced, the base material gets shorter and shorter and shorter and shorter until it finally runs out. When the base material runs out, you have a form of programmed cell death. Another term for that is apoptosis. So you have this programmed cell death that essentially is at the root of a lot of the aging syndrome. Okay. So telomere shortening is an effect that can be delayed through caloric restriction, thereby lengthening lifespan. That's one of the approaches, is caloric restriction. We've heard a lot about caloric restriction, or restriction of calories, not eating certain kinds of foods, especially that are high calorie, high energy, high sugar especially, and carbs. Eating more vegetables and fruit that are lower in the sugars, especially vegetables. These kinds of things can affect aging because they, for many reasons, including the level of antioxidants in the food, but also they affect the telomere length. So more rapid aging comes with more sugar and more starches, just like the requirement for, in diabetes. The treatment with insulin is because insulin is the hormone that responds to glucose to help to draw it into the body's muscle tissue and so on, and brings down the sugar level. Well, that same hormone is very damaging to your body partly because it restricts the transfer of oxygen from your bloodstream to your muscles. So we're basically asphyxiating ourselves in some sense by eating a lot of starches. So to improve the body's function, we need to alkalinize. We need to basically have more oxygen available. So that's an important point with regard to insulin and diabetes. Well, the same idea is happening when we eat a bunch of starches, because we're going to be spiking our insulin. Insulin is going to be surging every time we do that. And thereby we end up with a reduction of oxygen transfer into our bodies. And we are creating more of an acidic environment and more inflammatory environment. And so it affects our health and our age, our physiological age. So we see rapid physiological aging when people are using a lot of these things, surges of insulin, eating sugars and just pumping more insulin. That's their approach. A lot of people do this. You know, a lot of diabetics are not really well informed on diet choices and how they affect their blood sugar and how damaging it can be to use that approach, if you want to call it that, to a lifestyle to affect your blood sugar regulation and therefore your oxygenation, therefore the quickness of aging as a result. And certainly this is one of the ways I educate my diabetic patients, is in this area. But caloric restriction, as I was saying, is an effective way to delay telomere shortening and therefore improve your physiological age. Okay, so you know, I've seen 80-year-olds who can move better than 25-year-olds. I know one guy who's a yoga master who moves around like nothing. He teaches yoga, doing very, very well physiologically in his aging. He's in his 70s. So there's a lot of people like that that have kind of defied this whole aging thing. And why is that? Well, is it because, you know, they're just genetically better off? No, not necessarily. I mean, sometimes maybe. But looking at their habits and their approaches to life and their management of stress, you can see why they end up really in younger bodies if you look at them in comparison to others of the same chronological age. All right, so caloric restriction is one way, and specifically staying away from the starches and sugars is an important part of that, because those are very high calorie. Okay, those are very high in sugars and very high in that insulin response that we want to avoid for the most part. We want to manage blood sugar sort of on a consistent basis at consistent levels throughout life. It's the spiking that's so damaging, that happens when you overconsume starches in one sitting or any of that sort of thing, or even regularly, kind of even with a slot machine effect, but that kind of thing. So we all experience our own individual versions of aging, the aging syndrome, and the approach of caloric restriction can help to improve that individual scenario. So in addition to delaying the shortening of telomeres, we can actually potentially lengthen telomeres. And that may sound like quite a claim. So let me tell you that there's research to back that claim up. In fact, as recent as 2011 and 2010, there's been some studies. If you want to look some up, Bernard, I guess it's French, de Jesus, maybe it's Hispanic, Bernardes de Jesus et al., 2011. And that's B as in boy, E-R-N-A-R-D, like Bernard, E-S, de Jesus. Meaning, that's the spelling of Jesus there. So Bernard de Jesus et al., 2011. Demonstrated this in mice specifically, and Wang, Zhong, Sun, Yu, and Tong in 2010, this is a Chinese study, showed that human female lung tissue telomeres could be lengthened, even when critically short. In other words, when they were about to show cell death. And DNA damage could could also be repaired. So this is an essential element of aging, the telomere length, and this can be reversed, as shown in these studies. And substances studied in the Chinese study certainly were, which was with human lung tissue, were herbal substances that I use regularly in my practice. And this is one of the areas where I am basically voyaging into the anti-aging realm, I think in a significant way, because there are combinations of these extracts that have shown efficacy in not only stopping the shortening, but actually lengthening telomeres. Okay, so that's kind of an important thing. We're actually on the fringe of turning around aging, of reversing aging. I say on the fringe because, life gets in the way sometimes, things happen, but we have approaches that can be taken to minimize the aging effect, okay, at a minimum. Another example would be related to Alzheimer's and cognitive impairment, dementia, all of this sort of thing. Proper diet and nutritional intake has been shown to potentially delay the onset of Alzheimer's. And that's a huge thing right there. There are studies showing that the risk of cognitive impairment, dementia, and Alzheimer's were inversely correlated with elevated vegetable and fruit consumption. So in other words, the more vegetables and fruit you're eating, the less likely you are to have the Alzheimer's occur, and certainly the onset is delayed. So on a more broad basis, an inverse association was found with adherence to a Mediterranean diet specifically, including high legumes, high amount of legume in the diet. Legumes being things like lentils and this kind of thing. Vegetables, fruit, and fish intake. And specifically, I'm going to throw in that it really needs to be wild-caught, cold water fish to really have the best result. And nowadays, I would say preferably from the North Atlantic area to over in Norway, that kind of region. Very cold waters and less industrially polluted, basically. So another correlate here was to delay the onset of Alzheimer's and also help to avoid it potentially, was a low beef and poultry intake. Now that's interesting because a low beef intake, I talk about that all the time. In fact, I don't eat any beef personally. And avoiding beef can help with aging. But also that applies to poultry. So chicken and turkey are also in this group. So I would emphasize, based on my clinical practice and all that I have seen, the beef. I don't think beef is healthy, especially if it is the standard conventionally raised beef. Absolutely, those areas. If you're eating beef with hormones and and antibiotics and other chemical substances that are injected into them and put in their food and so on, and they're not free range animals, you're definitely consuming something that's very inflammatory, affects your hormones, and affects your immune system. The same can be said for poultry raised in a similar fashion, right? If it's conventionally raised, then it's not very good to eat. It's not good for your health. Whereas if it is free range, you have a better chance that it's not going to cause as many issues. All right, so lots of legumes, vegetables, fruit, fish, especially cold water fish, wild caught, not farm raised, as well as minimal, if any, beef. Minimal poultry is the way I would put it. So my personal emphasis is on lots of cold water fish, wild caught cold water fish, and I don't consume either one of these. I don't consume poultry or beef, or pork for that matter. So vitamins and minerals that may help to reduce the effects of aging are functionally related to the processes involved in aging. So in other words, specifically antioxidants are naturally occurring vitamins and minerals that donate electrons, right? We talked about this a little earlier. The antioxidants are a very important part of this as well, because they're helping to repair oxidative damage that contributes to the aging process. This is something we've known for a long time. Although still, I hear conventionally trained individuals minimize this. And I'm always astounded at people who are so supposedly well-educated putting down nutrition. I mean, I'm floored, honestly. It's just ignorant. And I think a lot of it has to do with a lack of training in the nutritional realm. I think they need to look at the research. I can tell you where all this research is. You know, there's tons of it. There's one of these is related to the oxidative damage and helping to repair, and the results on reducing aging, or the effects of oxidation contributing to the aging process, is Lacan and Vieira, 2008. Okay, take a look at that one. So when we talk about antioxidants, some of the ones that first come to mind are vitamins A, C, E, and selenium. Very important, very potent antioxidants. Yet there is an antioxidant that is 100 times more potent than vitamin C. And vitamin C is a very powerful antioxidant. And it's called astaxanthin. Astaxanthin is very potent, and in fact, if you're eating wild-caught salmon rather than farm-raised, you're eating salmon that is full of astaxanthin, along with other great nutrients like vitamin D. And then the fish oil that's inside that fish is wonderful for basically anti-inflammatory activity, and could say lubrication is one way to look at it. So it helps joints be more mobile. It helps your body repair itself with good fats. It helps to improve vascular flow and vascular repair. And by way of these cold water fish oils, the omega-3s, you can increase the quote-unquote good cholesterol, HDL, or high-density lipoprotein, and make up for some of the damage that's reflected in, not done by, but reflected in the low density lipoprotein, or LDL cholesterol, known as the bad cholesterol. Truth is, no good, no bad. They just have their functions, right? But HDL, more presence of HDL, essentially is understood to be a more heart healthy environment. And that comes with consumption of omega-3s. Now, fish is not the only source of omega-3s. You can get it in vegetable form. You can get it from many sources. But if you are not vegan, totally vegan, fish is certainly a good source. And specifically cold water wild caught fish. So what if you're eating the farm raised stuff? Well, just as a side note, okay, so the pink that you see in the salmon is from consumption of the seaweed that has astaxanthin in it, okay? Otherwise, that salmon would be gray. It's a gray fish. All right, now if you're getting farm-raised fish that's raised on a farm, it's not picking up that color from the wild, from algae. It's not picking up that color from astaxanthin. It's picking up that color from being fed substances that contain essentially artificial colors, although they're not really artificial. They're actually coming from species of cochineal or beetle type species. So what they do is they crush these red beetles and get the juice, that's beetle juice, and feed that in the food to the salmon to give them a color that resembles what they would otherwise pick up in the wild through astaxanthin. So anyone who has issues with eating beetles might have a problem with that, or maybe is allergic to those substances. And that's one of those allergies that may not be listed on even the allergy menu at a restaurant. Okay, you might have a reaction if you have a reaction to insects, if you have an allergy to insects, if you eat farm-raised salmon. But my overall point is that these foods, the lentils, and reflecting on the Mediterranean diet, the lentils, the vegetables, the fruit, and wild-caught cold water fish, and particularly salmon, is very good as a part of an overall diet that helps to improve the aging result, we could say, or could be considered anti-aging as a whole. And the antioxidants, vitamin C, E, A, and selenium, which is a mineral, very important mineral, help to reduce the oxidation that goes on in your body, and therefore the damage that's done by the free radicals, which are essentially molecules that have an electron popped off of them, making them ionized and changing some of the things going on in your body and doing actual cell damage. The antioxidants have contributor electrons, in other words, have the ability to bring back the electron into that chemical soup to bring your body back into balance. So they're very important. And it's also been shown, back to the cognitive function, that this can be improved. Cognitive function meaning like the dementia, the Alzheimer's kind of response, these kinds of things, memory issues, can be improved due to effective repair of the fatty membranes of vascular cells, the veins, arteries, veins, capillaries even, and a resultant reduction in the level of inflammation throughout the body, and particularly the brain. If you want to know more about that, you can look at Bowman 2012 and Morris 2009. Dementia may be delayed through the kinds of extracurricular activities that include physical, social, and mental components as well. So it doesn't have just to do with food, but certainly if you don't have the right resources to help your body do the repair, it's not going to happen. So anyone who poo-poos nutrition as important in your health has an agenda, frankly. Okay, because they're not speaking the truth. And we know a lot of where that agenda comes from in the United States. I don't even have to say it. So, okay, then there are other studies backing up the neuroprotection that exists with vitamin E supplementation, for example. And there have been studies about vitamin E and negative studies and so on. Just look at the source, you know. But vitamin E supplementation can help with the repair of the cell walls because it's a very powerful antioxidant with regard to fat. And when combined with vitamin C, very important combination that improves the effectiveness as well. Okay. Another very powerful antioxidant is CoQ10, and I did talk about this in the last show. It assists longevity by helping to prevent and treat disorders, including cardiological and immune system issues. CoQ10 helps to keep the energy levels and cognition optimal. Again, as I mentioned in the last show, it helps in that energy production that goes on in each cell through the organelles known as mitochondria. Those are our little energy factories. And CoQ10, coenzyme Q10, plays a role in that energy production. Another important one would be acetyl L-carnitine in combination with CoQ10 and alpha lipoic acid and vitamin C. So if you're getting all of these nutrients in significant quantities, in the right quantities, meaning the effective quantities, you're crossing that threshold into clinical effectiveness, there will be an improved result as far as cognition, even muscle mass, cognitive acuity or sharpness, memory, energy, all of these things can be improved. Now, again, what I'm talking about here is all for knowledge's sake. I'm not trying to treat, cure, prevent disease, and I'm not trying to treat anyone listening. However, you can see there's a plethora of information, plethora of studies that back up the use of these nutrients, especially the antioxidant nutrients, in reducing what we know as aging. So we can be healthier longer. Okay. So looking at the biochemical mechanisms of Alzheimer's itself, Alzheimer's disease, and some other brain issues like schizophrenia, even, there are some things in common there. Okay. Now, am I saying that Alzheimer's is a form of schizophrenia? No, I'm not saying that. But there are common elements in the biochemical mechanisms, and specifically regarding the nutrients that help improve these processes that are going on. So there are substances that help to improve the levels of dopamine, noradrenaline, levels that are important in kind of the get up and go that we all hopefully can experience optimally. And then the action of certain neurotransmitters like N-methyl D-aspartic acid, or NMDA, and acetylcholine. These are very important in the action of our brain, the working of our neurology. And so these are natural substances that I'm referring to that have effects definitely equivalent to, according to the studies, to the actions of the drugs, like Aricept, which is a commonly used drug for Alzheimer's. All right, so they can be not only helpful in delaying the onset of these issues, but helpful in terms of improving an individual response mentally. And they can have neuroprotective effects against even nerve death. Okay, like that happens with the activity of excitotoxins like MSG, monosodium glutamate, artificial sweeteners like aspartame. These are excitotoxins that create overactive synapses in the nerves and can lead to nerve damage and nerve death. Okay, so not only do these natural substances help with the improvement of cognitive function, but they help to repair the damage that may be linked to a lot of why those things are going on in the first place. So that's treating the underlying cause, which is my favorite thing. Okay, so there are a lot of other substances of interest to improve upon or delay the effects of aging as well. The antioxidant, another very potent antioxidant that we've seen in studies a lot is resveratrol. It can have an effect of increasing lifespan at a very limited amount, even 100 to 200 milligrams per day. But I'm not dosing anyone here, okay? I'm just saying what the studies show. So resveratrol triggers the protective regulators involved in the genes. So this gets very technical, but it triggers the protective silent information regulator T1, SIRT1 gene, which prevents apoptosis, which I mentioned earlier is programmed cell death. So it prevents that natural kind of result of cell death through a certain protein, okay, and through the action of protein deacetylation, or in other words, the removal of the acetyl radical. But see, like I said, it's a little too technical here. But it also binds directly to the telomeres. So it's very important in this kind of anti-aging mode. Resveratrol can also be combined with many other elements, like, for example, one of my favorite substances is an antioxidant known as pycnogenol. Pycnogenol is a very important component, or a very important OPC itself. What OPC means, oligomeric proanthocyanidin. But what that is a very potent antioxidant. And if you combine pycnogenol with resveratrol or red wine extract, grapeseed extract, these kinds of things are very potent, especially as a combination, and help with the aging response, or in other words, help to stem the aging process. Okay. And I particularly myself, and I like a form that comes as an isotonic, which is from a company known as Nutrimetrics. And if you're interested in doing some of this for yourself, you can always go to our website, which is aptw.net, and find under RX Nutrition, you'll find a link to Nutrimetrics, and you can go in there and search for OPC or OPC3, and you'll see what I'm talking about. Very good component in an anti-aging regimen to help with anti-inflammatory activity, improve blood flow, many parts to that equation. So it even helps to protect against diabetes and the results coming from diabetes, like the vascular damage and the aging effects of that. So we have others, Uncaria tomentosa, which is also known as cat's claw. It's a well-studied herb with antioxidant and anti-tumor effects, including apoptosis in tumors. So we want cell death in tumors, right? So it helps to do that. Helps with DNA repair. And again, everything I'm telling you is from studies. This isn't fabricated in any way. This is all from very scientific, well-studied, peer-reviewed studies. All right. If we look at others, there are many that are anti-inflammatory, and inflammation is certainly an important aspect of aging as well. It's very damaging to our bodies. We see a lot of syndromes related to inflammation, such as elevated cholesterol, lung disorders, COPD, asthma, many things, cardiovascular disease related to inflammation. What about bone and joint issues, right? Arthritis, inflammatory disorders, rheumatoid arthritis even, which is more of an autoimmune disorder. So all these are inflammatory disorders. If we can bring down the inflammation, we live a better quality of life. Do you see how much is here that I'm talking about? There's so much that can be done. And what we have prominently in the United States is kind of a wait and see positioning going on. We'll just watch as these things progress and then we'll deal with it, kind of thing. And how is that going to be done? Well, that's going to be done with acute approaches. In other words, addressing all of the signs and symptoms that come with the things that could have been addressed preventively earlier, leading to a much higher quality of life. So there are natural anti-inflammatories, many. Okay, one of my favorites is curcumin, which is an extract of turmeric. That's a commonly used spice, especially in places like India, and Thailand too. Thai food uses a lot of curry. These kinds of meals can be helpful in terms of bringing down the inflammation, but curcumin can be supplemented as well as an anti-inflammatory. There are many others. You've heard of, I'm sure, here. Right now, this show is taking place in December, and so we have the Christmas holiday coming up. And one of the stories from the Christmas stories is the story of the three wise men. And what were those three wise men carrying? It was gold, frankincense, and myrrh. And what were the frankincense and myrrh for? Well, little tidbit for you, the frankincense and myrrh are anti-inflammatories, which are very useful for birthing pain. Okay, so it makes sense that frankincense and myrrh would be part of that package that they were bringing. All right. That's the relationship there, though. So those are anti-inflammatories that are natural. They're extracts, basically like sap that come from certain trees, um, can be used to bring down inflammation. I'm not suggesting you go tap a maple and that's going to help your inflammation, because the sugars in there might be an issue. But specifically, frankincense, which has another name that a lot of people know, the Ayurvedic name is Boswellia. And that's in many anti-inflammatory formulas. Myrrh is as well, but I think Boswellia is becoming more prominent as an anti-inflammatory. So all of these things can be used. We have many types of substances, from antioxidants, anti-inflammatories, substances that help to improve the neurotransmitter function, to help with the brain aging and minimizing that. Many, many substances. So all of the precursors to the brain activity can help that brain activity be sharper, and substances that help to remove a lot of the debris can be helpful. There's a lot of things like this. So speaking of debris, another approach is to detox, to get the debris out of your cells, to clean your cells, because the debris that builds up interferes with a lot of the cell activity over time. And so by helping to clean out the cells, you can help to reduce the debris and therefore make the cell activity more efficient and more functional. And therefore, again, remove some of the effects of what I know as, and what I call, the aging syndrome. So you've been listening to my third show in a series on natural approaches to the syndrome of aging. If you'd like to read an article regarding this, pay attention to Tampa Bay Wellness Magazine, because you'll see an article relating some of these things I've discussed today. Coming up, I believe it will be in the February issue, February 2016. So you'll see more on this. And if you want to hit their site, it's tampabaywellness.com. And you can look at the most recent versions of it. Look, my articles tend to be toward the back of the magazine, and you'll see natural approaches to the syndrome of aging in there. By myself, Dr. Christopher Jackson, PhD, DO in Florida. And you've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And next show, we'll continue this series on natural approaches to the syndrome of aging. And we'll get into more about that. Let's see what I'm planning here. I'll look at my own plan. Let's see. So we've been talking about some treatments or approaches to dealing with the underlying cause. Next, we'll get into some of the ways that we can intervene, or interventional programs can be helpful to help people with this aging situation. We'll talk about it. So you've been listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And if you want to check us out, I should mention, take a look at our website. That's aptw.net. And you can call us if you like at 727-329-9637. And we'll talk to you next time, Thursday at noon.